You're listening to Petri Dish. I'm Bonnie Petrie. The Centers for Disease Control buried a warning about the potential for more measles outbreaks and the need for people to get vaccinated late last month. Public health experts wonder if this is evidence that the federal agency is falling in line under its new leadership. Robert Kennedy Jr. has been head of the Department of Health and Human Services for 3 months now. Before that, he was an environmental attorney who was best known as a professional vaccine critic. So it may not be surprising that a report urging folks to get vaccinated was pulled before it was posted on the CDC website. ProPublica reporter Patricia Callahan covers the CDC and public health, and she broke this story. So, Patricia, let's dig into the details.
So, the CDC has a division inside it that was created in the wake of COVID. And the intention of it is to be like almost like a national weather service for disease outbreaks. It's to predict what diseases are heading our way, like meteorologists would predict storms. These are modelers and, scientists who study data and use it to make predictions about how disease might behave. And the CDC sort of expert team looked at this, and their forecast found that the risk of catching measles is high in areas near outbreaks where vaccination rates are lagging. And the communications team at the CDC got together to work on a plan to roll out this information for the public, right? Because, measles is on a lot of people's minds right now, and they wanted to make sure to get that information out in ways that, the general public could understand. What is your risk for measles? And their rollout plan, which I got a copy of, emphasize the need to get vaccinated because the best protection to avoid measles is to get vaccinated. It's a very effective vaccine. And as they were, about to roll out this plan, they got an email from somebody within their ranks who said that after discussion in the CDC director's office, and I'm quoting from the email, leadership does not want to pursue putting this on the website. And so this plan never saw the light of day.
And I know you reached out to the CDC about this.
Yeah, I asked the CDC, why did you pull the plug on this? And what the media office said was, well, we didn't release it because it doesn't say anything that the public doesn't already know. And the spokesperson reiterated that, the CDC continues to recommend vaccines as the best way to protect against measles.
And it's what they said next that became the foundation for your story.
Yeah. So the CDC spokesperson said the decision to vaccinate is a personal one, and that people should consult with their healthcare provider to understand their options to get a vaccine and should be informed about the potential risks and benefits associated with the vaccines.
Which does not sound at all like the CDC that we're used to.
That is absolutely a shift in how the CDC usually talks about vaccines that can save lives. Normally, it doesn't mince words when it comes to vaccines. They have always projected confidence, and it shifted to this is your personal choice, and you need to think about the benefits, but you also need to think about the risks. That is a different message than we've heard from the CDC in the past.
But it is a message that we've heard from Secretary Kennedy in the past. Now, you talked to Jennifer Nuzzo, who is the director of the Pandemic Center at Brown University School of Public Health, about this. What did she say?
So what Jennifer Nuzzo said was that this shift in messaging and the squelching of this, kind of routine announcement is alarming to her. And she said that she was actually stunned by that language about personal choice and risk. And the statement that the CDC sent me, they made it sound like this was a coin toss, and the number of cases that we have now is more than the number we had all of last year. And as you know, in Texas, there are areas where this is really raging and it's spread to multiple states. It's not a coin toss at this point, she said.
Well, a lot of folks in Texas and beyond might say that personal choice is not a bad thing.
Well, I think people forget that measles can be deadly. It's a disease that can kill both children and adults. About 1 to 3 in 1,000 people will die of measles. And another risk of measles is even if you have a case that seems like, well, you're miserable for a week, but you're better, research has shown that even a mild case can wipe out your immunity to other things. It can cause almost like an immune amnesia. So when that virus that your body has seen before comes back, they don't recognize it and you get sick again. And so that's why people in public health circles feel so strongly that this is something that we have a vaccine for that can prevent serious illness, disability, and death.
And 2 children have died in the West Texas outbreak so far, which means we're at 2 out of 541, though I'm sure that there are many cases unaccounted for out there. Do you know if Secretary Kennedy personally had anything to do with the report being kept off the web?
No, we don't know. We do not know. I mean, I asked HHS what role, if any, Secretary Kennedy played in the decision not to release this risk assessment. And the communications director at HHS said that this was just, an ongoing process to improve communication, nothing more, nothing less. I would say also, though, that the spokesperson for Secretary Kennedy reiterated that Secretary Kennedy believes that the decision to vaccinate is a personal one. Right. And so the same messaging that the CDC put out was the same messaging that Secretary Kennedy's spokesperson put out.
Thank you so much, Patricia Callahan from ProPublica. They do fantastic work over there. If you don't follow them, I strongly encourage you to start. And thank you for listening to this Petri Dish update on the measles situation in Texas. Part 3 of our Petri Dish special, Psychedelics and the Texas Trip, is coming soon. I'm Bonnie Petrie. Talk to you soon.
Support for Petri Dish is made possible by UT Health San Antonio, committed to transforming the health of the community through a team that tackles problems from every angle, doing everything it takes to bring each patient the best possible outcomes. From teaching tomorrow's healthcare leaders to translating research into new treatments, UT Health San Antonio strives to make lives better. Learn more at everythingittakes.org. Support for TPR comes from the University of Texas at San Antonio's Brain Health Consortium, a pioneering research hub advancing neuroscience, neuroengineering, precision medicine, and more. Learn more at utsa.edu/BHC.